Hello, I would like to begin by sending a message of respect and solidarity to the Anishinaabe Algonquin people, whose unceded and unsurrendered land we come to from you today. My name is Alexander McClelland, and I am the chair of the steering committee of the Canadian Coalition to Reform HIV Criminalization. I'm someone living with HIV, and I'm an associate professor of criminology at Carleton University. For the past 8 years, the Canadian Coalition to Reform HIV Criminalization, a group of people living with HIV, legal and human rights experts, and other actors in the HIV sector, have been working tirelessly, including in collaboration with the Government of Canada, to change our criminal code and to end the terrible harm stemming from the criminalization of HIV non-disclosure in our country. Despite years of calling for change, Canada continues to hold the heinous designation of being a global hotspot for using harmful punitive laws to address HIV non-disclosure. Despite years of revolutionary scientific advances and a widespread worldwide consensus from lawyers, social scientists, legal and human rights experts calling for an end to HIV criminalization, over 225 people living with HIV have been prosecuted in Canada since 1989. But this month, after years of promises and commitments, we have been told by the Canadian government that there is no longer a path forward on law reform. As the federal election looms, instead of demonstrating bravery and finally ending criminalization, our political leaders have shut down progressive reforms. And they have told us that they are not moving forward on evidence-based approaches, that they are not moving forward on findings from their own consultations, and that they are not going to change this context, which puts the over 65,000 people living with HIV in this country at risk, who are currently made to live their lives in a context of fear and uncertainty and violence. Sadly, we truly believe this World AIDS Day we would be here for a different reason. We know we deserve better.
My name is Katarina Bogosavljevic. I'm a PhD candidate at the University of Ottawa and a steering committee member of the Canadian Coalition to Reform HIV Criminalization. Our coalition has spent years providing the Government of Canada with solutions for sound law reform. We've consulted with the HIV/AIDS community and put forth proposals for change time and again. Bills for reform have always been pondered, but they have never been produced. Canada's Minister of Justice, way back in 2016, first acknowledged the overcriminalization of HIV non-disclosure. In 2018, the minister implemented a directive to limit charges related to HIV non-disclosure under federal jurisdiction. This directive was limited to the 3 territories and mandated an end to the use of sexual assault laws in this context. This recommendation was echoed in a 2019 House of Commons report following the Federal Department of Justice's own study of HIV criminalization. In 2022, Canada launched a federal 2S LGBTQI+ action plan, which promised to hold consultations on criminal code reform. The consultations ended in January 2023, and the resulting report reaffirmed that using sexual assault laws in this way is inappropriate. In early 2023, the former Minister of Justice met multiple times with our coalition, again promising reform measures. But since then, another Justice Minister was appointed. Movement towards concrete change stalled, and progress has now come to a halt, with the clock ticking on a 2025 federal election.
Hello, my name is Colin Johnson. I'm a person living with HIV and a member of the Canadian Coalition Steering Committee and co-chair of the Toronto Harm Reduction Alliance. I want to touch on the social issues and how the impacts affect all of us. Firstly, there's a disproportionate amount of impact on people who are marginalized, especially Indigenous and people of color, where we face discrimination and more arrests and more charges and longer space time. There's also the issue of immigration. After someone has served time, then in many cases they're deported back to countries, many of whom have heinous and crucial homosexual laws. All of us live in fear. We cannot be sure what will happen and when it will happen, whether your partner, just because of a grievance, might actually call and report you for this. This is really serious and it really affects us on a mental state. The other area is people who are charged and convicted are entered into the sex offender registry. This means they cannot get jobs. In many cases, they cannot get housing. This also impacts just the social existence of people like myself. Ultimately, criminalization affects us all in ways that I don't think many people can understand and even appreciate. On this World's Days, we definitely ask everybody to look forward and help us move forward with this, but more importantly, to get the government to act. Thank you.
Hi, I'm Chris Turiram. I'm the MSM Ethno-Cultural Resource Coordinator at the AIDS Committee of Ottawa. 25 years ago, I was diagnosed with HIV, and I'm successfully living with HIV. I am thriving. But 22 years ago, I was charged with aggravated sexual assault because I kissed a person, and after kissing him, I proceeded to disclose my HIV status. He beat me to a pulp and left me for death in my own condo. I was knocked unconscious. When I came to, I called 911 and told them that this person is out there, that from his fist to my face to his fist, there's all this blood transfer. There might be a case that he might be, well, he was in contact with HIV. So they found him at an emergency. He did not call 911, I did. And once they found that, I dealt with the ambulance people, but once the police found out, I was no longer the victim, he was, just because of HIV. So this person, of course, is a white privileged person, and he is a foreigner, a visitor to Canada, but he was sent home without trial, unheard of, just because of HIV. Then, sorry. So I just want to say that the harshness of this law is what's preventing people that are HIV negative to go get tested, because they know that disclosure and the shame that comes with HIV will cause them to, they don't want to know their statuses, and also it prevents people from getting treatment, seeking treatment. And unless you're undetectable, you cannot become untransmittable. So this is where the HIV virus is spreading, from people who are afraid to go get tested. And in the 2024 AIDS conference, there was a joint minister's message that came out from the Honorable Mark Holland, the Minister of Health, and the Minister of Mental Health and Addictions, the Honorable Yara Sachs. And they said the government of Canada launched a sexually transmitted and Canada bloodborne infections, STBBIs plan, to 2024 to 2030 to meet global commitments to reduce to zero new HIV infections, zero discrimination, and zero AIDS-related deaths. We have a chance to attain those figures, but with this law, I don't see Canada attaining it. It's one of the more serious law punishments in the whole world that Canada has. And unless we abolish this law, we will not reach those figures. Thank you.
Hello, my name is André Capretti, and I'm a lawyer and a policy analyst at the HIV Legal Network, and also a member of the Canadian Coalition to Reform HIV Criminalization. HIV criminalization is unscientific, discriminatory, and undermines public health. It treats what should be considered as a health issue as a criminal one, but it doesn't have to be this way. In 2022, our coalition conducted extensive nationwide consultations and developed a community consensus statement outlining our opposition to the current status quo. We believe that HIV criminalization should be a last resort, limited to the extremely rare cases of actual and intentional transmission. Criminalization is never warranted in cases where the scientific evidence is clear that there is no real risk of transmission. Yet to this day, people living with HIV in Canada can still be criminalized in cases where the risk of transmission was zero, or even where they took precautions to prevent transmission, like wearing a condom. We also advocate for HIV non-disclosure to be removed from sexual assault law, a position supported by feminist organizations and legal scholars. Ultimately, we need criminal code reform to bring clarity, certainty, and consistency to the law. The current legal standards set by the courts can vary significantly based on province or the type of sex involved. That leaves people living with HIV in a really scary and frustrating state of uncertainty, not knowing what their legal obligations might be. Even if they aren't themselves prosecuted, they live with the constant threat of criminalization hanging over them. The government recognizes the injustice of this situation. That is why they have themselves reiterated the need for law reform on many occasions. And we agree, law reform is necessary and long overdue. International bodies like UNAIDS agree, just this week stating that laws, policies, and practices that punish, discriminate, and stigmatize people obstruct access to HIV prevention, testing, treatment, and care. Even Prime Minister Justin Trudeau agreed as recently as last year on World AIDS Day when he stated himself that existing non-disclosure criminal law over-criminalizes and stigmatizes people living with HIV and AIDS, discouraging them from seeking testing and treatment. So it defies common sense and understanding that the government would abandon law reform efforts after years of cooperation from key stakeholders like our coalition who are working with them, trying to find solutions to the status quo that we all agree is problematic. At the end of the day, people living with HIV deserve better, and we know that Canada can do better. So while we're here today to share our disappointment, rest assured that people living with HIV are strong and resilient, and this is not the end of the story. Our coalition will continue to fight against overcriminalization and to advocate for human rights, justice, and evidence-based policymaking. HIV is not a crime, so let's start acting like it. Thank you.
We will now take questions on Zoom. If you have a question, please use the raise hand function. Nous allons maintenant prendre les questions en ligne. Si vous avez une question, s'il vous plaît, utilisez la fonction main levée. Is there something you would like to add to your statement?
Is there anything that anyone wants to add? Sure. Yeah. Go for it.
I just want to make it clear how this affects people of color. I mean, apart from the fact that we're over-criminalized to begin with, this just adds another level of criminalization for us. And for many people, especially newcomers who are unaware of the laws, they get trapped in a circular thing that leads to their deportation. They're coming from countries to make a better life here. That's what this is all about. Let's give them that better life by ensuring that everybody is treated equally and fairly, and we have a just system. The law that we have now does not do that, and that needs to be changed. Thank you.
Thank you. This concludes the press conference. Merci. C'est ce qui conclut cette conférence de presse.
Thank you.